While health experts around the world are breaking down the number of coronavirus cases that are confirmed, it's hard to ignore which communities are most impacted by the outbreak. New numbers from the CDC show African Americans make up about 33% of confirmed cases of COVID-19 in the U.S. Just note, African Americans only make up about 13% of the general population. Meanwhile, 45% of those in hospitals for the virus are white and non-Hispanic, even though that group makes up more than 60% of the overall population. Dr. Anthony Fauci, who
high blood pressure, asthma, diabetes, obesity, and other underlying conditions. So if you happen to fall in a group where there's a disproportionate amount of those, already you are at a greater risk of the complications of coronavirus disease. And it just so happens, through years and years of situations that the minority communities have had to face, they are disproportionately represented in those populations with those risks.
Well, here in Arizona, the Department of Health Services breaks down the amount of confirmed cases by ethnicity as well. Right now, the largest group of confirmed COVID-19 cases are white patients, and a very small portion are minorities. But the death rate shows something different, with a higher percentage of Native American and Hispanic deaths.